So that's actually one of the things you said you wanted to ask about was how education has changed for paramedics, and that's part of it is that one of the big things that's been a big change that we stole from nursing and from medical school is the simulation-based training that is much more integrated now into paramedic, and we're integrating it all the way down the line even to EMT, so that instead of just practicing a lot of skills, every level is practicing now these high-fidelity simulations in context that are taking real time, so that when somebody says, I need you to start an IV, oh, and I need to drop this med, and I need you to go ahead and get a 12 lead in this, they realize very quickly that's not all going to happen at once. It has to be given its own timetable, and they have to allow for that. So I think that is a big part of the transition from EMT to medic. It's a related skill set of having to know who's where, who's doing what, and that conflict resolution. You referred before to some of the culture clash sometimes between EMS and fire-based services, because I think a lot of the communication issues are just for anybody is a misunderstanding. It's people thinking they know what the other person's job is, but not really knowing it, and making assumptions about it and coming to it with their own sort of lens. And if you don't know the firefighters, if there's 200 firefighters in the city, and you're regularly seeing maybe like 16 of them, then you're always going to be meeting these people who are vaguely familiar, but you have no sense of how well they're going to do.